Well, thank you guys for joining me again while I present this video. My name is Claudine. If you're new, welcome. If you're returning, thank you so much. Please subscribe to my channel so we can continue learning together. Just to introduce myself, I'm Claudine. I'm a nurse practitioner. I'm a mother, I'm a wife. And today we're going to talk about something not commonly talked about, yet it happens every single day in our working environments. If you're not familiar with what healthcare is, stay tuned here. And definitely, this is something you can learn from. You probably have a loved one who works in healthcare, whether as a nurse, as a CNA, as a medical doctor, nurse practitioner, or even as a physician assistant. There's a lot of different departments within healthcare that people have to intermingle on daily basis. But today I'm going to focus mainly on what is really going on in terms of bullying, in terms of gaslighting within the healthcare profession. So just to give you a little bit of a definition of gaslighting. So gaslighting in nursing often occurs when a coworker, a supervisor, or even a manager denies events that actually happened, shifts blame for mistakes unfairly, questions your competencies without basis, undermines your confidence and credibility, and even makes you feel isolated or irrational when raising concerns. So this is not something just subtle, but it develops over time, and it's something that can affect you not just physically, but even emotionally, socially, or even affects the way you deliver your services for your patients. So let's talk about this. A little bit about me. I started out as a CNA, and when I worked back in the years, I won't mention the specific facility because I worked in three different facilities when I was in Iowa. But I'm going to talk about one specific thing that really happened to me and one of my friends that we worked with. So we ended up walking out of this place, and back then, this is at least 15 years ago, I'll say, yeah, at least 15 years ago. And looking back, I will do things differently now that I know what I know. But back then, we ended up walking out of the place. So we were working the afternoon shift, which was 3 p.m. to 11 p.m. And we tried to hold back as much as we could. But it got to the point where it was either this gives or we give. But we ended up walking out. So we walk into the facility. As you know, there's different hallways. So there were four hallways in this building. It was like in a T-shaped, so four different hallways. One hallway for one CNA, which had about 16 to 20 beds, and another one the same like that. But it just happened that the two hallways we were assigned had the heaviest patients. And this one, we worked on Saturday, we didn't complain. We went back to work on Sunday, the same heavy patients. And we talked to each other. We were like, no, this can't be happening. So we worked our shift for that day. We finished. And we were working every other week, every weekend actually, because we went to nursing school. And you know, as a nursing student, you don't have much time to work. So that's the most we could get weekends. We come back the following weekend, it's the same thing. No, I'll take that back. We come back the following weekend. It's a different nursing team working. We are assigned different hallways, and we had a very good balance with the other seniors that we were working with. So we finished our weekend work. We were happy. We went home. We continued with our nursing school. The following weekend, which was now the third weekend, we come back, and it's the previous nursing team that was working, and we get assigned the same heavy halls. And you know, with nursing homes, it's always the same patients 99% of the time, because they're not really living unless somebody dies or they transfer out to another facility. It's not like rehab where you can say, okay, I'm here today, in 2 weeks when I come back, they're gone, there's a different team. No, it was the same patients. So we get assigned the same hallway, and we're like, okay, we tried to talk to this nurse, and we're like, this is what we did the last weekend when we worked with this different team. Can we do the same? Just so it's balanced. These two hallways are very heavy. And she wasn't budging. She wasn't going to listen. And we talked. Nothing changed. So my friend and I were like, you know what? This is it. I walked out. I told her I'm walking out. And she said, I'm walking out too. So we walked out and we quit. And that's how we left the job. In the world of today, if you walk out like that, that's going to be an abandonment. And this can go against your license. It doesn't matter whether you're on the right or the wrong. You've already accepted assignment. These patients are your responsibility. So the moment you walk out of your facility for whatever reason, you are facing abandonment charges. And yes, they'll win against you. But this can also go different ways. If you feel that it's unsafe for you and you have a justified reason, you've said you've talked to this person, they're just not listening, you probably can win, but it's going to be a fight. So let's talk about some of the signs of gaslighting in nursing. So one thing is that you're constantly doubting your memory or your judgment. And this is not necessarily related to what you know as an individual. And it's probably because of so many doubts that you face. People always judging you, asking you, are you sure? Didn't you go to nursing school? This is something basic. Of course, there's things that are basic that even me, I would expect somebody to know. But when you try to present yourself and somebody is always doubting you, that's not good. That's questionable. The other thing is that you're blamed for things beyond your control. So let's say an example, you are assigned 7 patients in med-surg and it's overwhelming. All these patients are demanding, but you're running behind on your schedule. Instead of being able to give the 9 o'clock meds on time, it's probably like 10, 11 o'clock, you're still doing your meds. Besides, you have 7 patients. Management may not be within your control. You're used to maybe 5 patients or 4 patients if you're lucky. But the fact that you're running behind, this will not be within your control. But somebody in leadership may see you as a lazy person, you're just not doing your job, blah, 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 always trying to blame you. These are things that are not within your control. And if somebody is really understandable, they will know and say, hey, you know what? You're doing the best you could. How can I help you? How can I step in? That's what we want with our leadership, with our management. The other thing is that your concerns are dismissed or minimized. So they talk about you being too sensitive or you not being able to prioritize your life, not being able to prioritize your job, what you're supposed to do for the day. Instead of listening to you, then you dismiss your concerns. You always feel isolated or targeted. You know about all these nursing bodies, people who are always together, and you might not be the type of person who fits into their cycle. So you always find yourself isolated to the point where even if you need help with something, it's difficult for you to approach because you feel like you don't belong to that group. And this is normal. It's normal not to belong within your nursing community. Everybody is different. People are different. People's social lives are different. And some people just want to come to work, do their job, and go home. They don't want any life after nursing with their colleagues because that's what it is. I have my cycle of friends from my place of work. And we hang out, we talk, we laugh together, and that's about it. And not everybody is comfortable in this way. Some people just want to come, clock in, do their job, clock out, go home, wait for their paycheck, and they're done. That's okay. So the fact that some people gaslight you may make you feel isolated. And the fact that not hanging out with people from your workplace doesn't mean they shouldn't be able to ask you questions. They shouldn't be able to ask you for assistance when they need it. Always be open and ready to help. Teamwork. You can't beat teamwork, right? Yeah, it makes things easier. So the other thing is that you always feel like you're walking on an eggshell, especially when you're constantly self-guessing yourself or you're constantly isolated from a certain group of people. You feel like when you walk past them, you're the type of person they're talking about. So some of these things may be like red flags for you to know that there's some kind of gaslighting that might be going on. Because even if you do not belong to a group, a real person, and this is quote unquote, a real person will stop and ask, hey, do you need help? We are gonna go ahead and go for break. Do you want us to help with anything? They'll come back and say, oh, have you been on break? It's time you need to step out. Go take a break. Go drink some water. Come back. Can we help you with anything? So that's what we really need to do as nurses. So we are not eating our young. You know what that means? Yeah. So how do you handle gaslighting in nurses? So one thing is document everything. If it wasn't documented, it wasn't done. And anything you document can be used against you in the court of law. So try and keep detailed information. Time-stamped records or even conversations may help save you, especially when your concerns are dismissed by your management team. They feel like you're just lazy or not focused or managing your time poorly. Always making sure you document. This can help with evidence and to avoid false accusations. The other thing is set clear boundaries. And this is just basically about the burning part of it. If you don't want to hang out with people outside work, that's good. If they invite you, just tell them, hey, I'm sorry, but I can't join you guys. I keep my relationship professional, and that's it. Nobody should judge you for that. You're just setting your boundaries. The other thing is seek a trusted support system. And this is tied to one of the videos I did previously, especially if you're transitioning into your new role as a nurse practitioner. This is something that can really help you. Having somebody, a support group. I work as a nurse practitioner right now, and let me tell you, I have my to go to people. There are people I even reach out to when they're not working. Hey, this is the situation. Please help. And they will help me in a heartbeat. And that's the same thing you really need to do. Find your support team. If you work with them in the same rotation, that's even better because they can be there to help you one-on-one. If you have a question, they can just step in and be there for you at the moment. Versus if you have somebody who's not working, who's on your opposite rotation, they may not be able to help you in real life, in real time, if I may say. Let's say you ask them a question, they're probably vacationing somewhere. I try to stay away from work when I'm vacationing. And this is just me. So that might be the case for this other person as well. They might choose not to look at their phone. They might choose not to respond at the moment because responding to one means you start a conversation and this can just imbalance you in whichever way. So making sure you have a support system, preferably one within your same rotation. This can help you. This can make work easier for you when you step into work, when you're working through your shifts, and make things lighter for you. The fourth, is to stay grounded on facts. Do not try to override things. So if you're following your facility policy, make sure you stick to that. Somebody might choose a different route, but that's what they choose to do. But if you know what your rules are, what your policies are, try to stick to that. If you're supposed to have 5 patients, but you have 7, try and stick to that and say, hey, I don't feel comfortable having 7 patients. I don't feel it's safe, especially if they're heavy patients. Some patients might be walkie-talkie, as we may say, they're easygoing. That's still okay. But remember, other than just doing one-on-one care with them, you need to document. You need to do your rounds on these patients. So having patients can put you at an unsafe situation versus if you had 5 patients. And this really varies on day shift versus night shift. Day shift is more busier, especially with the fact that there's different departments working within. You have therapy, you have physicians doing their rounds, you have different things. You have dietary, you have family visiting. So all this can really imbalance you if you have 7 patients versus if you have 5. The last thing is prioritize your mental health. As a mental health psychiatry nurse practitioner, I can't tell you. That's one thing I don't negotiate with. When it comes to my mental health, my physical health, my self-care, that's one thing I prioritize. And I hope you do the same for yourself. One thing they say is that you cannot pour out of an empty cup. So you have to take care of yourself before you can safely take care of another person. So that's one thing you really need to prioritize on. Take your days off if you need to. If you feel like you're not able to go take care of a patient in a certain situation, a certain day, Make sure you prioritize that. You don't want to walk into work and you're mentally imbalanced. You probably had something going on at home. You have a loved one who is sick. Your mental health is a mess. Please, please take care of that before you go take care of somebody else. Because let's say if you are going through a lot of anxiety, irritability issues, you can snap on a patient, even unexpectedly. And it's not because you wanted to, but it's because you are overwhelmed. So always make sure you take good care of yourself before you go to take care of patients. And take advantage of employee assistance program. Most places have this, at least the places we have worked at. They do have this for you to utilize and to ensure you are well taken care of. Please, please, please. If you face gaslighting at your places of work, get help, because if this is not taken care of, you will realize that your place of work is just another place that is not just giving you a paycheck, but it's helping dig you deep into mental health issues, mental health, depression, anxiety, post-traumatic stress disorder. There are different things that can happen which will not help you in a way. So that even by the time you get that paycheck, you ask yourself, is it really worth it? And when you realize that you're safe, your work environment is no longer safe for you, it's time to move on. Move on before you fall into an unwanted situation, because trying to get you out of that may not be easy. So I hope this video can be helpful to you. Make sure you watch out your places of work. Be ready to move on. If you realize that this is not working, you don't want to push yourself beyond your limits. It's okay. It's okay to step away and find a better environment for yourself. You'd rather start fresh with new friends, with new policies, with new work environment than push yourself in an environment that doesn't serve you right. Until next time, peace out.